At the Center for Spine Health, we have a integrated, multidisciplinary team that is dedicated to the health from a spine standpoint of the patients coming into our practice. And we can harness that expertise in the surgical realm, in the non-surgical realm, through our physical medicine providers, and offer the full spectrum of non-surgical care. Again, the concept is get patients better without subjecting them to invasive treatment, if at all possible. And I think that's our overriding theme here. We're not just a team of surgeons. Our surgeons are here for the select group of patients that require a major surgical treatment, but the reality is the vast predominance of our patients are treated in a non-surgical, conservative manner.
It's all under the one roof at the Center for Spine Health. So we're able to provide all aspects of care right here. All the individuals from the front desk staff to the assistants to the physicians are extremely caring and thoughtful. We're able to provide really efficient care. Generally, you come in, you're able to get your care all under one roof and get in and out in a reasonable amount of time. We have multiple locations throughout the state to help individuals so they don't have to travel too far as well.
A patient calls up for an appointment, they're guaranteed to see someone that is really dedicated to treatment of spinal problems.
Well, the other great thing is being part of a large, highly skilled group is we don't have to look at the spine through a magnifying glass. We can look at the whole patient. And this is a very common occurrence. Adult patients routinely might have leg pain, and while a spine surgeon might look at them and say, well, this is a spine problem, it may be a hip problem. And maybe seeing one of the hip surgeons to take care of the problem first would be more appropriate. And the same is true with our pediatric patients. Often patients will have a curved spine, maybe a deformity of a leg or a pelvis that may be affecting the whole picture. And we have to plan a comprehensive treatment approach to do the best thing for this child with the least invasive means possible. And so having the expertise of multiple specialists is crucial.
As part of our University Orthopedics initiative to improve the patient experience, we've tried to make access better for our patients, and part of that is developing two major sites on each side of Narragansett Bay. The East Bay, our Kettle Point facility in East Providence, and on the West Bay we have our facility on South County Trail. Both of those sites provide same level parking, very direct access to our facility for patients who may have impaired ambulation capabilities or who require assistance or simply can't travel long distances. So the idea is to make it as convenient as possible on each side of the bay to provide the highest quality care in close proximity to where patients live. We have an overriding philosophy that every patient should be managed in a non-operative, a non-surgical way, if at all possible. And that concept relates to the fact that, first of all, many spinal disorders will improve over time, however severe the initial symptoms are.
Our goals when we first interview or see the patient is to really establish what they want to do in life. And then we try to tailor treatments to sort of get them to do their goals, whether it's sports, whether it's gardening, whether it's just going out walking. And that's our essential way we take each individual as a person and try to get them to where they want to be in life and maximize that.
Patients often have conditions that are being either misdiagnosed or not diagnosed at all, treated on their own. And when they come to our office, the first thing that we really try to do is to use our ears to listen to them tell their story, our eyes to see whether they're having any obvious areas of trouble, and our hands to really move joints, move the spine, and to help figure out the cause of their trouble.
And a lot of the treatment, even though I'm a spine surgeon, is really directed towards helping them through this acute episode. Most of the time relying on just a natural healing process and trying some things that may speed up that process. But only a small percentage really come to a point where they may need, say, surgical intervention.
Patients that come to see us with back pain and neck pain have a whole bunch of different types of problems, and it's our job to figure out what's the right treatment for the right patient at the right time. So first we have to establish a good diagnosis through good proper physical examination, see how they respond to physical therapy, see what their imaging shows We can use injections both to help treat them and also help pinpoint where their pain's coming from and help them understand that surgery is an option. Sometimes surgery is the best option, sometimes it's a great option, sometimes it's a very big decision to undertake surgery.
I think the most important thing is that your patient understands what's going on. Education is so helpful and important. I have a number of patients that I know that they walked away already feeling better, not requiring maybe that opiate or whatever, just because they had a better understanding and they weren't afraid anymore. And they said, oh, okay, it's not whatever is building up in my head, which is typically the unknown, frankly.
The Center for Spine Health is affiliated with Brown University due to the fact that we are a teaching institution. We train medical students, residents, and fellows to help provide the next generation with the tools to be able to take excellent care of spine patients.
I'm sure they look upon it as, we're donating our time to them, but in truth, it really is beneficial to us. I think they're forever questioning, what we're doing, why are we doing this, isn't there a better way? And I think that's very important for what we do, in terms of questioning, maybe there's a better approach. So I think I love working with the students and residents. I think they really provide an awful lot for us.
We're often there to answer questions day and night, 24/7, which is very important, especially after surgery. When you have many questions, you're concerned, you're nervous about your recovery process, so we're always available.
The physician assistants are usually in the OR about once a week with the physicians, so it helps us a lot to really be able to explain to patients what to expect, both before surgery, during surgery, after surgery, so we're really able to kind of hold their hand through the process and walk them through things. We also see them post-operatively as well, and so we get to see their whole journey from beginning to end.
The team approach that we have, that's really what I think is something that's different here at University Orthopedics. Dr. Robertson and I work very closely together on every patient, and we see them together in the office as well as seeing them in the OR. And this really allows me personally to be able to follow on their journey from beginning to end.